Hello and welcome to lecture 6.6, How the Internet has Changed Communication in Medicine. Just to remind you again, go up to HD as much as you can allow to see all of the text clearly. That may suit you, may not. So the good news is about this lecture is that there are no assignments associated with it. And in all three locations, Dublin, Penang and Bahrain, students have completed or are just about to complete the two short assignments, and I've given some limited feedback in those locations. And if you've received a direct email from me, please respond as quickly as you can. So the learning outcomes for this lecture, it's quite involved, are as follows. To understand the impact of the internet, that the internet has had on patient communities, to understand the principle of open access patient data, to understand the issues regarding the quality of data on the internet, and to understand the impact of the internet on medical education. So, associated with this lecture, there are 4 papers to read and review, and I'll come to those in a minute. Now, when I say read and review, I don't need all students to be able to recite these papers verbatim, word for word. I'd like you to read them and just to gain an understanding of the core concepts. It's not something you have to do immediately, but it's something that I expect all students to do this term. As I say, you don't have to understand every single word in these papers, but please get a general understanding of what's going on. The papers are all available in Moodle as well, I should note that. So this lecture is actually based on this article, The Internet Ushering in a New Era of Medicine, which appeared in the medical student version of the Journal of the American Medical Association. It's linked there and also available in Moodle, as I've said. The journal it's in, the JAMA or the MS JAMA, Medical Student Journal of American Medical Association. JAMA is a well-respected, high-impact, peer-reviewed journal. It also has this student body or student arm, if you like. This paper appeared in 2001, okay, 11 years ago, which for a lot of you is half a lifetime or more. But really, I think it's an important paper as it's not out of date as such, and it covers some very basic concepts. It's not looking at iPhone apps or high-speed internet connection as such, or brand new technologies as we may know them now. It's looking at basic core principles that have changed with the implementation of the internet in medicine. So it's really, you should consider the article. As I've said to you previously, now that you're in medical school or physiotherapy school, you may find that friends are approaching you and saying, "What's wrong with me?" and they're pointing to a lump on their arm or whatever. A lot of people are turning to you maybe already for advice, but think about it. A lot of people turn to the internet for advice when they're sick, and there are studies to show that vast amounts of people, this is their first stop. So do you do it? And I assume you do. I do, certainly. I'm looking up various ailments in the family or whatever it might be. So this is where people go if they're sick. Their first port of call is the computer in the corner of the room that has access to such varied and rich content. So those papers I mentioned, as one from the BMJ, British Medical Journal. We have a subscription in the college. The paper is also available in Moodle, so you don't have to look it up. You can get it yourself directly. It's a short article. Another relatively short article in the BMJ is Googling for a Diagnosis, the use of Google as a diagnostic aid. And here it's an actual study of what's going on in the use of Google. Google gets all the press, as you know. It's almost at this stage like there isn't another search engine out there. Rightly or wrongly, that's the way it is. So these researchers have published a paper based on the use of Google as a diagnostic aid. It's a very interesting paper, and also, and I suppose this is less important in the scheme of diagnosis and illness, but the impact of e-learning and medical education. That's in a journal called IT, or Information Technology in Medical Education. So as I say, the 3 or 4 papers, don't review them in finite detail. don't get down to understanding every single letter in them, but I would expect students to have an overall appreciation of what's going on in them. Okay, in the general overview here, we're looking at 5 topics really in this lecture. Communication. So the Internet of Medicine, how we're building communities for patients with rare diseases. Now, rare is probably the wrong word to use here, in that that's how this started, in that people with very rare diseases were looking for information, so they start to communicate with each other. This is now really across all diseases. The other part of this mosaic, these 5 topics, is the National Library of Medicine's website for physicians and patients. So that's reference material. Then we're looking at the issue of quality, and that's what some journals call an e-health conundrum. Quick access versus quality assurance. The information may be available, but is it any good? Then, and this always appears skills, but I'm actually of the opinion that the skills are disappearing very quickly. The actual skills of accessing information. It was considered a skill 10 years ago to be able to use the internet. Now maybe not so much so, but you should certainly be conscious of the fact that a lot of your patients firstly may not be able to access the internet for a range of reasons, and not just skill based. Maybe they just don't have access to a computer due to their economic standing. They may not have access to the technology in their house. They may be of a certain age that the use of computers has passed them by completely. So whereas most people have these skills, there's a section of the community perhaps that will never have them due to some socioeconomic disadvantage. So really be careful of that one. And then finally, medical education. And the tenet here is that it changes everything. We can deliver education to anybody, anywhere. Well, not anybody, obviously, if they don't have a computer, but the fact that we can change how education is delivered. So you're really thinking in those 5 terms: communication, reference, quality, skills, and education in this lecture. So let's look at that, building a community for patients. And certainly for in this area, there's no doubt that the internet has completely transformed the definition of community for patients with a disease. This is without doubt a profound impact on patients in general, and one perhaps that we don't give a lot of thought to formally in medical schools, just yet anyway. There are so many websites, bulletin boards, chat rooms, you name it, videos, audio of patients with various diseases. What's going on? You type in any disease into YouTube, you will get something from the correct to the bizarre, I'm sure, but it's out there if you want to look at it. And what this really, it's not the information that is available, I think, in this context. It gives patients a voice. It allows them to say, to articulate, to shout out how they feel. And when you're sick, and this is well documented, people feel alienated, bewildered, they're scared, they're apprehensive, and this may be a place, the internet may be a place that patients can go to, firstly to get that feeling of frustration off them, and secondly to look for some kind of support. And that's where we're getting to the word community, the support for the patient. And in this case, I'm looking in this particular lecture, I'm focusing on breast cancer, and you'll see why in a sec. And here is the reason. So this is my friend Sue. Sue is a good friend of mine since my childhood, and I should point out that at this time that Sue is completely happy with me discussing details of her illness and using her picture. So there she is, and I just spoke to Sue last night about this. She's completely happy, so that there's no ethical issue of me using Sue's content. That's really important. We'll come to that in another lecture, but I need to point that out quickly. Sue knows what I'm doing here. So my friend Sue was diagnosed with breast cancer in 2005, and it's a form of cancer that can't be cured. And at this stage, Sue has endured almost 7 years of treatments, various different types of treatments. So I would theorise that Sue knows St James's Hospital, which is a big hospital in Dublin. She knows it better than most. But Sue didn't take this lying down. Sue did something. And Sue is that type of person. Sue doesn't sit still. Sue wants to take action. Sue doesn't take no for an answer. Sue is proactive. So what Sue did, she published a book about positive stories to give people support about cancer and to help people in a hospital with cancer. And that's what Sue's, what can I do? I can tell people or help people be positive about their disease. And Sue just didn't write one book. She wrote one and then had it printed 10,000 times and then distributed it for free to James's Hospital and other oncology departments in Ireland. Now, to date, Sue has raised also, on top of all of that, she's raised €30,000 for cancer research to buy equipment for the oncology department at James's Hospital. That's one person having all of this effect. Now, that you might think that's okay, that's fundraising, that's heightening awareness, but while Sue was doing that, she built her own community. And the book, Thump the Lump, or Tump the Lump, did she? I've left out an H there, I'll put it in, I'm not quite sure. The book then spawned websites and so forth and so on. Sue went on an extensive media campaign to Thump, yes, TH, I knew that, for people who are living with cancer. A week didn't go by where we saw Sue on TV or heard her on the radio or saw her in the newsprint. Sue went very head on to build this community. Sue tried a website and then I think she found her natural home in Facebook. So she then started to build this community and used all the tools available to her. And the impact, I would say, is profound. Now, you may not have heard of this, of course, but then you haven't had breast cancer, or maybe somebody in your family has, and they have heard of it. But the point is that Sue built her community in the community of breast cancer sufferers, or in the community of cancer sufferers in St. James's Hospital. And it was Sue who constructed this community. Sue is not medically trained. Now, if we take that a little bit further, Jarlath Bulger, who is an employee of the college, also gets involved at another level at Breast Cancer Ireland. And this site is specifically aimed at breast cancer sufferers, and although it's run by medics. And you can see here, I haven't run the video, but it's a breast cancer self-exam, and Jarlath is pushing this video out so people can look and support themselves. And you can see hopefully the website is nice and clean and fresh and easy to navigate. So it's aimed at patients specifically in the community of breast cancer sufferers. And of those of you who've just recently joined RCSI, it's just something specific, I suppose. In the front hall in RCSI, there was a giant picture of an iPhone. And here we have, I suppose, the modern day application of this community, in that there's a free app for your iPhone, which was only updated last month, which allows people to become aware, breast awareness, the whole important thing. It's a medical and educational app promoted by Breast Cancer Ireland. It helps women through a reminder to perform the checks monthly or quarterly. So what this is doing is getting out into the healthy community and reminding people maybe to examine and check for the signs. And that's what breast cancer is all about. It's about prevention. So I suppose there's three examples there. There is the community that my friend Sue lives in. These are the actual cancer sufferers themselves. I suppose in Sue's case specifically breast cancer. Then there's the community that Jarlath is, Dr. Bulger's involved with, is the Breast Cancer Ireland, getting people to look online and to perform the exam. And then, although it's the same community, maybe a little bit more refined in some way, in that they're or a more limited community is the iPhone owners, people who have an iPhone who can then use the app to perform the exam. But anyway, I'm sure you see where I'm coming from. We're no longer limited to this communication via face-to-face meetings, telephones or mail services, whereby people attended in hospitals or doctors' surgeries and were given information there and then, and they went off to reflect about it. So what we have is that And very much in the literature, people feel neglected and vulnerable, and that's not through any issue with the healthcare professionals themselves as such. It's just they have been, in some ways, they've given a huge piece of news, these people who are ill, and now they feel a little bit neglected and vulnerable initially, and now they have tools necessary to relieve fears and answer questions about specific diseases they may have. So this is an immensely powerful and a vital tool for communication and education. We can't really underestimate what's happening here. We went from 20 years ago where the only information available was locked up in medical libraries or hospitals to it now being available on a smartphone that somebody could look up on a bus, on a train, anywhere they wished. And the real key here is to disseminate accurate and current information. This is where it's absolutely vital. We need to provide the right information and to advocate this empowerment of the patient. We can still advocate empowerment, but the information could be wrong, and that's probably one of the downside, the major downside to all of this. So the fundamental advantage here is to connect seamlessly information. Information is available to everybody across locations and time zones. You need the information at 3 a.m. in Seattle or 4 p.m. in Dubai. It's available to you. Excuse me. There are severe demands on the time of health professionals, and this is one of the reasons where I say patients start to feel somewhat vulnerable or distressed. This is one of the factors that contributes to that. And that a physician may deliver some bad news, but they're busy, they have to move on. I do not think any physician really wants to deliver bad news very quickly, but there are constraints on their time. And this can leave communication gaps between the physician and the patient. And it has certainly been documented in the literature that patients, whereas they're listening to some bad news, very often they just don't hear what's going on because they're stressed. And it could be 20 minutes or 2 hours later, and they think, I should have asked this, what about this, what happens here? Indeed, the recommendation for a visit like that is that patients write questions down and write the answers down, or bring somebody who will write down the answers, because there's a lot of information being imparted very quickly. So that can, as I say, that demands on time in a face-to-face interview can lead to gaps in communication. And what we're hoping with this accurate and current information is that we can give support for patients and compensate for this lack of education and support services. And although it's not the complete answer, it is some of the answer. So what we're looking at, as I said, the websites or apps on a phone or something like that. So they're valuable channels of communication and can share practical ideas, emotional support, and comparison of treatments. And we're talking about patients here, really. Although, as I said before, Dr. Bulger is involved in supporting, and Breast Cancer Ireland in supporting patients. We're looking at patient communities, really, specifically. And in some cases, you get the idea of, you get the notion that don't worry, it will get better. You just feel sick now because of a certain course of treatment, or my treatment did this to me, I felt like this, so people know what to expect. Certainly in conditions, in rare diseases, and I suppose in any other disease, but specifically in rare ones, there can be very complex information. And what can happen is that the information is in the patient communities can be re-explained in more simply and more understandable terms. But one of the big pitfalls here, and this is really vital, is that it costs. It doesn't cost anything to set up a website, but it costs to set up, say, an iPhone app or something, to develop something at that level. It also might cost to get information checked, to get a physician involved. It'll cost certainly time. I'm not talking about money, just getting somebody to commit in time to look over the information. There's issues of privacy and certainly fraudulency. So these things need constant attention. You can't have somebody posting information that's patently incorrect. So this may lead, and this is the single biggest pitfall, is bad quality information. Patients, as I say, they're vulnerable, they're looking for answers, and they may not know the difference, what is good and bad quality information. So there is where it all pivots. And you will hear over time, either from patients or other healthcare professionals such as yourselves, well, you've got to be careful with the internet. Don't be too sure what you read on the internet is true. But I would counter that and say, yes, that's true, but there are some sites on the internet that are well worth visiting and promoting. So it's finding that balance and knowing why you've found that balance. So in that context, I want to look at the National Library of Medicine, their website for physicians and patients. And think of it like this. I've said it in the previous lecture. A patient walks into your office clutching a big sheaf of printouts from the internet. I spent all evening surfing the internet for the latest information on a particular disease. And they're prepared to talk about this. They want to talk about this. But it's also possible, of course, that the patient has brought some bad information. So what do you do in that situation? I think it's wrong to dismiss the patient. Yes, that's great, but look at this information. I think it's really important to recognise that the patient has maybe done an awful lot of work, an awful lot of preparation, and to guide them gently, perhaps, to what you consider to be a good source of information. And I would just like to say, although I'm talking about the National Library of Medicine here, it's a good example, it's not the only example. So who are they? It is based in the United States of America, and it's their National Library of Medicine, NLM, and it's funded by the federal government and is the world's largest medical library. It is vast, mind-boggling how big the source of information is here. At the physician-doctor level, they include books, journals, technical reports, manuscripts, which they would consider peer-reviewed, good quality information. It's aggregated into one place. And in some cases, some of the world's oldest and rarest books, which in itself is very interesting historically. So the National Library of Medicine hosts two websites, Medline and MedlinePlus, which we'll look in more detail in a second. So Medline, it stands for Medical Literature Analysis and Retrieval System Online, and it's an international literature database of life sciences and biomedical information. So not just medicine, but pharmacy, nursing, and lots of other biomedical information. So basically anything that gets published in a journal ends up at least listed in Medline. Maybe not all of the information is available, but the abstract or part of the journal article is there. And as I said, nursing, pharmacy, dentistry, veterinary medicine, biology, biochemistry. So there are some with no direct medical connection as such as molecular evolution. So we're not looking at something that's strictly related to treatment or diagnosis of disease, but certainly biomedical will cover it. So the National Library of Medicine compiles Medline, and it's freely available on the internet. And you can search it by through a site called PubMed. So Medline is the actual collection, and PubMed is the interface. And we'll just look at an example of that on a line in a sec. But the point to remember here is Medline is really for healthcare professionals. It's for people researching or working in the area. That's not to mean it would exclude members of the public, but it really is aimed at healthcare professionals. Now I've taken two screen grabs here. This one is about a year old, and this one I took this morning. Just curiously for me, as I was reviewing the lecture, there's 21 million citations 1 year ago, and now there are 22 million citations this year. I don't know how quickly that number is growing, but I wonder will it be 23 or 24 next year. So it's a very simple interface. You just search. There are various different categorizations in the service. Very simple, pubmed.gov. There is, you can see the very tools and help guides and that kind of thing. It is designed to be quick and easy to use. You may have already used this in one of the previous short exercises. So MedlinePlus, slightly different. The website containing health information for the world's largest medical library again, and it's intended to be used by healthcare professionals and patients, and that's the crucial point. Both the healthcare provider and the patient, and it's designed for this up-to-date, current and authoritative information. Good, reliable data, patients and their healthcare providers. The information comes from all over the United States. It has an American bias, leaning, flavour, if you like. But that's, as long as you know that as you enter it, it's okay. There is the screen grab was taken this morning. It is also provided in Spanish, which is the second language in the United States at the moment. Popular searches, what are people looking at? Snoring, high blood pressure, gout, diabetes, aspirin, lots of things you can see there. Back pain, very straightforward. News for today, the 24th of October, meningitis outbreak somewhere in the United States, 23 dead, substance abuse, diagnosis increasing, so forth, so on. Now this looks like an advertisement here in that, it looks like it's selling, say, stroke medicine, stroke medication, but it's not actually. What they're doing is just promoting information on stroke. And I would urge you to take a look around this site. Very simple, very straightforward, laid out, easy to use. So the information they're using, they use guidelines and they select information that's educational, sites or information. So there's people selecting this information that's appropriate to patients, well organized, easy to use. Do not promote a product or service, so not commercial. That's really, really important. They're not looking for somebody who's selling a drug, selling a device, selling a service. And they're looking for information that is primarily dependable. And how they determine what is dependable, they look to see if there's an advisory board with listed names of people against a website, like an editorial committee. Somebody could have written something, it may be good, but they want to know who's written it. And they want information that's consistently available. Now that sounds kind of silly, but they want websites that are available all the time, not something that goes on and offline. It has to be there all the time for patients. And they want a site that has reliable and maintained links. I'll give another lecture about evaluating websites and criteria I would use to evaluate websites later on in the course. So, other content in Medline and MedlinePlus, dictionaries, indices of hospitals and services and physicians, dentists in the United States, fantastic medical encyclopedia, and information on thousands of prescription drugs. And of course, the thing with prescription drugs, they would have one name, generic name in the United States, and maybe a generic name, obviously generally, but a product name in Europe or the Middle East or the Far East may be different. Drugs are sold under different names in different regions. So that's one thing to be careful of. And what MedlinePlus will do, will give links back to the Medline database where all these papers are stored if somebody wants to read the actual referenced material. So the two are linked, but it's not highly obvious upon initial inspection. So MedlinePlus, as I say again, I just want to get this across to you, it's not the only source of information, but it's a good place to start. It sounds like I may have shares in Medline or MedlinePlus, which in itself is silly because they don't sell shares, they're not commercial service, but I'm pushing this service because it's one of the best examples there are, no other reason. So in summary, we were looking at these 5 areas. Communication, how the internet has changed the community-based aspect for patients with various diseases, how they communicate with each other. About reference, Medline and MedlinePlus, and how we determine quality. Now there'll be more of that in another lecture, but you should be really conscious of the fact if you're looking at something online, a question you should be asking yourself is this good quality? In all cases, is what I'm looking at good value information, and can I trust it? I've mentioned the skills again. It's just, as I say, all of you listening to this, you're on YouTube or you've downloaded it to some device or something. So there isn't an issue with your own skills, but remember that not everybody has the skills. Not all of your patients will have the skills that you have, particularly those in a disadvantaged area or perhaps older patients who may not have used a computer ever in their working lives. And medical education, you're part of this community now. You're getting your information on Moodle. You're learning it maybe in new and different ways. And I think that's something you should just keep in mind as you go through the course. So what I'd like you to do now, in the next weeks, this doesn't happen to have to happen tomorrow, is to visit Medline and MedlinePlus. I would advise you to do that several times just to get used to the idea that it's there, and search both of these for using a medical term you know a little about. Just a little thing, something maybe that has affected your family or yourself, or something that you're curious about, and see the different types of results that you get between the two services. And also, if you find something or you've searched for something, see how they link, where the reference material in Medline links back to MedlinePlus. And I suppose, like anything else when you're learning, see if you can find out anything new about the disease you're looking at, or the drug, or whatever it might be. And try and find a learning resource online that might help other students starting with chemistry, physics, or biology. And if you do that, post it in the forum. So, why not? If you find a good website, put it into one of the fora and allow your share your experiences with the other students. That may help. So what I'm really trying to get you to do, look at quality places to go, search for something that you may know something about, see if you can find something new or useful, maybe apply that then to chemistry, physics, or biology. Certainly where I'd like you to do, and this for me, it's 16 minutes long. This patient, it's quite an astounding story. If you read here, this student, David Bronkhart, learned that he had a rare and terminal cancer, and he turned to fellow patients online and found the medical treatment that saved his life. He actually found it, and now he calls on all patients to talk to one another, know their own health data, and to make healthcare better. And he now calls himself ePatient Dave. It's a fantastic story, available at the TED Talks. There is the link. If you just search TED for ePatient Dave, it will come up very quickly. But there's one man who didn't take the answer he got and went and looked elsewhere, and is still alive to tell the story. Don't forget the papers, the JAMA paper on which the lecture is based, Google, and the two BMJ articles, and the IT and medical education, all available in Moodle for you to download and use. Don't by any means read these in finite detail. I'm asking you for a basic understanding of what's going on. So thanks for that. If you have any questions about this lecture or any of the resources, or if you find anything useful, post it in the forum, please, in Module 6. Share your information with other students. One other thing you may choose to do, and I'm going to mention this again in other lectures, is go and look at the student British Medical Journal, student.bmj.com. You just have to sign up and register. They won't share your information commercially or anything like that. But it's a journal aimed at people like you, students. And you may find something useful there. So, as I say, I mentioned that again, but it's worth dipping your toes in that to get used to the idea of being subscribed or connected to a journal. Okay, thank you very much indeed.